Good afternoon and a warm welcome to our today's healthcare webinar. My name is Andrea Fricke, and together with my colleague Ben Potter, we are going to introduce you to our ecosystem mapping methodology, how it can be applied to your marketing objectives and strategy for owned brand assets and digital properties. Please enter questions you have in the chat, and we will address as many of them as possible live after our presentation. Any questions which we are not able to cover today will be answered by email within the next week. In recent years, pharma has invested heavily in digital enhancements and strategic online messaging. This trend only accelerated as COVID-19 lockdown mitigation measures were implemented. Measuring the value of these investments over time has been notoriously difficult. Healthcare professionals and patients have come to expect modernized landing pages that are pleasing and functional UX from digital properties within the pharmaceutical space. These expectations have coincided with an increase in usage of digital properties for healthcare-related needs, as patients seek to be more involved in determining their treatment plan more than ever. Executing digital strategy should be done in line with an informed channel strategy to optimize spend and effectiveness. It is not a one-size-fits-all approach, and local market variances and different therapeutic area characteristics should always be considered. Understanding our clients' online ecosystem associated with their assets will help provide actionable insights for their omnichannel strategy. We provide a comprehensive profile of activity associated with competitors, professional entities, and target stakeholders. This is designed to not only provide background and competitive intelligence, but also uncover areas of opportunity or white spaces for strategic initiatives. Patient and specialist insights will provide detailed behavioral preferences, information-seeking behavior, and journey stage insights to uncover key emotional characteristics and inflection points for decision-making. We look at each therapeutic area individually and report on a regional level so that insights may be applied as targeted or as broadly as your marketing initiatives and budget dictate. As many of you know, there are key differences in omnichannel behavior of specialists in each EU market. Patient behavior similarly varies as needs evolve within patient communities at varying rates at regional levels. Depending on the maturity of a disease area or the prevalence of a disease itself, the presence of patient advocacy groups may vary. In mature areas, advocacy groups have a strong presence and are key centers of influence for dissemination of information to patients. In cases of rare diseases, advocacy groups directly related to this condition are often developing, if present at all. In either instance, these entities should be viewed as key partners for messaging initiatives. Information flows in unique ways within each therapeutic area. Each will have its own influential stakeholders and trusted entities to be leveraged. I'm now handing over to Ben, who is going to walk you through the process in more details. Thank you.
Thank you, Andrea. I apologize, everyone. I was not able to unmute without stopping to share my screen. So back to the presentation. I appreciate it. It's a pleasure to have the opportunity to speak with you all today. My name is Ben Potter, and I'm an engagement manager leading ecosystem mapping projects for Ipsos's healthcare advisory group. Ecosystem mapping is essentially the process of mapping the flow of information within a specific therapeutic area, as well as identifying what its centers of influence are. Output should give you a sense of You know, if you push this lever, you'll get X output. If you push this lever, you'll get Y. So it helps get an understanding of how content moves around, and really helps with identifying channel optimization and assessing partnership opportunities. The whole process answers several business questions along the way, and I'll try to touch upon these as we get into some of the case study output later. But first, I just want to provide a brief overview of a standard ecosystem methodology. When we're mapping an online ecosystem, we're doing this using 3 pillars of data sources and research streams that often they're run in parallel. I have them sequential here, but these generally run in parallel. So the first, we typically start with 1 to 2 years of historical data collection through our media platform, Synthesio. If we're executing this as a multi-market research project, we would initially collect data independently from each country or market first for individual analysis and then synthesize it later. As much content as we can possibly pull, we do up front. This helps us analyze any recent growth or changes within an ecosystem. It also helps us understand key outputs such as understanding patient and HCP areas of interest, key topics of discussion within the context of the TA, of course, and unmet needs that these target audiences are expressing. We also use this data for measurement, and that could be HCP influential voices for KOL or DOL, digital online, digital opinion leader identification and relational mapping. We're able to do this because we do pull these high volumes of content, so we're really getting unaided qualitative responses from our target audience at a quantitative scale. So we're able to use it in both ways, and we'll always share the total volume and the numbers that we were working with you. Social content can also be used to generate a content prioritization assessment, which is something that comes standard with these projects now. And I'll talk through how we do a little bit of that in a following slide. And we always use it to identify content that we know has gained traction for two-way engagement from your target audience and to highlight examples. All right, the second would be search and web analytics. These are 2, but just lumping them together. We combine those to understand what the top search terms are within a therapeutic area. We often break that out by stage. We'll also utilize this to understand where search drives a typical user, meaning which website. And with those web analytics, we can see where they had come from before and where they go to from there as well to just help round it out. Next, there's really this sort of desk research competitive analysis that we do. And it's to understand pharma-owned patient and HCP-facing web properties, digital channel utilization across the board, and then advocacy group or professional groups activity within a specific therapeutic area. When we do this, it gives you 2 things. One is competitor benchmarking on a channel-by-channel basis. And through that, and I'll show you how we can utilize that to uncover areas of opportunity, or as we call them, white spaces. It also provides an understanding of what best practices are concerning digital properties throughout this specific ecosystem. So we do each one of these in isolation. There's sort of been a digital transformation that we talked about up front, and you don't want to fall too far behind that. So if your competitor set are offering features that you're not, we'll highlight those and assess their importance and probably either add those into our insights and recommendations or not. So all these together provides output like the whole online ecosystem profiling that we do, the content prioritization matrix or content evaluation matrix, detailed channel analysis. We do that using all 3, digital asset mapping, and then what I'm going to show next, which is an information pathway. So every project that we do, at a very high level, I'm going to be showing a lot of summary output, and then we usually have supporting slides. But this is just a high level, your mean patient, their information pathway that they would go, throughout the stages of the disease. And if in one of these cases it was chronic, and the other it was a later stage cancer. So we were able to do it in that way. But what we tried to do is really understand how they utilize web, social, search analytics, and what they're doing for information seeking behavior that's most commonly seen across each disease stage. When do they leverage search, and what are the most common words or phrases used? So we'll highlight that for you as well. Which websites or online sources are they most likely going to be driven to from search, like I just talked about? And then really, at what points do peer-to-peer interactions take place, and what specific channels and communities is this happening on? What you'll see for patients is almost always uniform, which is in the early stages, search is very high. And as they progress with their disease state, they become more invested in communities with their online behavior. So this slide shows a physician content evaluation matrix that was completed through only analysis of HCP social data. So if we're able to see, we calculated reach based on social and web reach. And then influence was really, we just calculated the degree of activity on social around these sources of information, how often HCPs shared or quoted the resources. And you can see the source types are color-coded here. I've taken all the names out, but this is always customizable. So you just customize that to whatever is most important to you. We're here to provide recommendations. I wanted to say this on the previous slide, but I'll say it now too. We do often leverage Ipsos of such a large company. We have excellent quantitative and qualitative research teams, so we'll leverage them when it's appropriate. We can also do so by request at the outset of a project, but we would talk to you throughout the process and let you know where we think that it would be helpful. So I'll talk about a couple instances where that might be possible, but this is in fact one of them, which is, we're doing this. If you're not comfortable with the way that influence is calculated among stage CPs, we just throw out a quick pulse survey to them, right? That would be a very easy quantitative survey at low cost and quick turnaround that we could do either to support these findings and or to replace using social as the primary data source. And in this instance, just for clarity, because this may cause questions, the specialty resources, the differentiators, which are really just the low reach, low influence, were all for this specialty journals for this specific disease area. So, please don't read too much into it. That was just for reference for our client, that these were their trade journals that they were reviewing. So I'll jump into case study samples now, and I want to show output from two very different projects to just show you a couple of the varieties of ways in which we can utilize ecosystem mapping to help our clients achieve their initiatives. So in this first instance, our client was pre-launch, and our focus was providing them a holistic understanding of a new digital landscape in preparation for that launch. So we did 2 years of historical data because they were seen as rare and ultra rare with their two assets. So 2 years we thought was prudent just to ensure that we had content. I personally like to do 2 years as much as possible, but sometimes it can get a little bit messy if we're in a very mature TA and you may just want recent information. So we would go down to 1 year. But with that 2 year, even in an ultra rare space, the findings here were comprehensive and touched on most of the output we offer with ecosystem mapping. So showing some of the more of the high level output from this project. We have asset mapping here, which is our client and all their competitor set. It's essentially an overview of who has digital resources available across each of the digital channels, and how they're using it. We do desk research and have domain experts that we utilize to build this out. Content that we evaluate, so this top line, and keep this in mind for the next slide, is always customizable. So I'm understanding I'm talking to an EU audience right now, and branded websites may not be so important to you, but that can easily be taken out, or it could be replaced with something like that I think is very important, which is conference attendance, right? So did they speak at a conference within the past year? Were they presenting trial findings, things like that? Did they partner for any thought leadership? So we can just, any way you want to benchmark activity, we'll provide our recommendations, but also know that we can customize this. It's really just a matter of setting that out up front or in flight. So we're going to now double click. So this is the first layer, which is just to see who is doing what and how on each channel. The next would be to double click into one of them. So we're going to do the branded websites from the HCPs. And this is what we saw. So we looked at each one of them, and now this double click into the individual property type gives us a zoom in on attributes that we want to measure. Right, again, it's customizable on a per project basis, but these are the attributes that we wanted to measure to see what was out there. It's an in-depth, we do this in-depth channel by channel look that allows us to really, this is when we start to benchmark features of interest against competitors. We can show you where improvements can be made, identify white spaces, which is where you don't see a whole lot of activity here. And then assess whether those should be leveraged or not. I mean, essentially, if there's a stated need and there's a white space, it's a very easy choice to invest in sort of developing that and pushing that out through channels. And then it really just gives you, you're able to more knowledgeably differentiate your asset by directly adjusting the needs of your target audience. So if we find a white space, we can align it with an unmet need. That's always a sure thing. This is another example where we might pull in another team. Sometimes to get a full breadth of opinions on a channel by channel basis, we may need to do, and usually qualitative is better for that, especially with HCPs. So we may do a few qualitative interviews, but again, something that we would discuss throughout the duration of the project. So what you see here, right, is that this is an ultra rare disease, keep in mind. So no one was putting in a ton of content or really high quality content that we saw. This is all relative to one another too. I think if we were to compare this to some of the more, oncology TAs, it would go down. But we did identify some white spaces. So because this was such a small area and it's done by these specialists, these nephro specialists, because this was in the renal space, they didn't really provide any access or facilitation to patient support, and they didn't facilitate peer-to-peer access either. So what we saw was that these HCPs did it themselves, and it was a direct result of a lack of peer interaction facilitation anywhere. There wasn't anything from the PAGs, there wasn't anything from pharma, because how rare these diseases were, and that these nephros were specializing so much. So we saw incredible activity that we don't see all the time, and it showed the many ways that they facilitated these interactions among themselves in several different areas. So their online journal clubs, that they were doing all of this publicly. So we'll tell you what channel it was on. We gave the examples of the journal clubs that we identified. They were doing their own interactive learning. So we found a couple of those that we could show, and we showed platforms that they were using for that. They were using podcasts. They were sometimes guest speaking on podcasts. There were ones that they consistently listened to, so we identified those and what channels they were talking about it on. And then this was the most interesting, was they had created their own games, their own ECME, essentially. They did 2 events. One was a like a U.S. college basketball tournament to see, it was questions where you'd face off against someone to see who had the most knowledge in the nephrology space. The other was that, but just a little bit more involved, and it was based on the World Cup. So the Neph World Cup, and it took place once every 4 years. So they were doing really, really innovative things. We were able to get the client to perhaps think about sponsoring one of these game events as an initiative to build relationships, right? Because this is a small, influential group of nephrologists. They're all interconnected when we did that mapping. So we advised, this may be good, just recognize what they're doing, maybe help them with it going forward. But as a general comment, not specific to this project, understanding initiatives, in this case, it was early detection was really their one talking point, that they needed more early detection for these renal diseases, and how could that be done. But just understanding that can help you with trust building and thought leadership initiatives, especially when you're partnering, but also when you're targeting these physicians. So this next slide, I wanted to show this example up because it was a pretty amazing finding, and again, one we don't see very often. First, the level of sophistication these specialists were using on Twitter, and what they were doing with it was fantastic. So I won't read through all of it, but they were sending each other visual abstracts and images. They were hashtagging things so that it could all be found very easily by anyone who wanted to look. So they were sort of storing it themselves. They were sharing videos and doing polls. And then they were doing these tutorials and Twitter chats where they actually ended up, because of, again, I think it's due to it being such a small space, but we saw HCP to patient interaction in this instance. And that's really something we very rarely see directly online. But as a patient, and this patient set was pretty knowledgeable and literate about their disease area, those who were engaged, so they could ask a question. If the HCP thought it was a valuable question, they would answer directly in one of these. So again, just taking a step back, I wanted to show that because that was an incredible finding to see all that they were doing on their own. And I think this helped shape some of what our client was now planning to do in terms of their pre-launch plan. But in general, it's always a good practice to understand what channels are being used by whom and at what level they're using them, right? Because that will help you determine where content should be pushed and what your own level of sophistication would be. I mean, it's sometimes if you're using, very maybe not Twitter in this particular moment, but in certain other channels, if you're doing something that seems very sophisticated, it may just go over the head, right? They may not know how to access it correctly. So you just want to align with that. And we'll talk more about organic content as we go through. So this is an example of how social analysis showed trends of patient behavior and shifts over time. I won't go through, I'm getting short on time. So what we saw was that this patient community grew. The disease has been around forever, but they were part of this this digital kickoff as well a couple of years ago. It eventually plateaued, but their needs continued to change. And one of the needs that's actually not listed on this slide, but one of the needs that we needed to call out was that what they were becoming most interested in helping each other with was dietary restrictions. We found from multiple sources an instance where they were saying which meals to prevent dialysis are the best tasting versus on another source, we found which ones are the easiest to cook if you're a little short on time. So we advised the client, we pulled it all together for them and we said, you should make one handbook with all of this in it. I think they would find it very useful because we're looking at different communities, they're talking about different things, and just make a one-stop shop. So address their needs in the moment. So I think that's something that they were doing as well. So I'll move on to the second case study now. It was for a client in a more established therapeutic area, and what they wanted their initiative to be was to leverage an ecosystem analysis, so output like you just saw, but to really dig into patient segments, information-seeking behaviors for a targeted messaging initiative that they had. So I'll show you a few ways in which we customize output to help with their stated goal in the next few slides. They came to us with existing personas. We were able to build off that and give them additional digital persona subsegments, and then behavior that they expressed. So usually in these cases, a client will have some previous work. Always best to share it with us so that we're not being repetitive, because we'll just build off of it like we did in this case. I think that would also be relevant for any advocacy group analysis that you've done. We would refresh it. We also have a proprietary methodology we use for scoring that we can share with you. And then KOL identification and analysis too. Sure, you've had that done, but we would refresh it and try to do some interconnectivity mapping based on what we've seen. In this instance, for this project, we also did utilize a post-quant survey to ensure we had information-seeking behavior for all the patient segments, even the new ones that we developed alongside their original set. So we'll always provide 2 cuts of messaging guidance to help any strategy that you might deploy. What we're looking at here is a view by segment. For segment-based messaging, it gives you who am I, what the emotions are, what I need, where I learn, what are my digital habits and channels, decision drivers that we were identified, what their most common questions that we saw popping up, and what their pain points were that we heard from them. That is for segment-specific messaging. We'll also do it by stage. So if you're doing a stage-based messaging, right, or you may do some mix of them, we'll provide a view like this. So this is the diagnosis and test stage and all that entails. We have our key pain points and barriers. If you look on the bottom, we also align again with the segments just to show you variances by segment to segment too. So we will build those personas. We'll give you 2 looks, but we will try to align this as much as possible. And then it's, you know, that can be taken and strategy built from it. So we really customize. This is from our executive summary. We really customize output to inform that communications plan. So we ran an ecosystem. We came back with a lot of supporting material, but which is where to find patients on and offline, what topics will reach them, what content or media types will reach them, and when the best time is to target them. And then we will always look over whatever time period we are to see what content is generating two-way engagement and is shared, and we'll highlight the attributes that we think cause that to happen for you. So this is just one of the slides, but patient stories and updates really got a lot of traction. That's something that they might have wanted to think about addressing in communication and/or adding to their site. And then content to promote knowledge and research was big. This was second line. They were, again, another really literate patient set, which is actually I think we're seeing patients become a lot more literate these days anyway. So more and more we'll see that, I think. But they were involved, and they didn't really they didn't want any sort of pandering or anything like that. They really wanted to understand where research funds were going and things like that. They didn't like some of the campaigns that they thought were safe for people to say that they showed support and not really back up things like that. So we just said steer clear of that. And then I'll wrap up now. I'm about at time, but what I hope that you got from this is, or some takeaways from insights that we would deliver through this ecosystem output would be improve targeting key segments and be able to do this in a timely and relevant way. So you're talking directly to your stakeholders, but you're using fresh information. You're understand what their needs are without having to ask. You uncover areas of opportunity for content development and in places or channels. That's what we call white spaces. So any white space that's out there that we can identify, we'll send across. We can optimize channel mix. So you're investing in your channel prioritization knowledgeably, and you follow a similar process for the KOL and PAG alignment and partnering too. Advocacy groups are going to be your best friend in getting content out, and I always recommend them as a partner, but picking the right one, depending on who they're currently working with and how many patients they're touching or what your sub TA is always important to understand. Next is to optimize channel mix. Next is to have the ability to generate content that feels organic to the ecosystem rather than promotional. Super important. You really don't want to sound tone deaf. Again, it's understanding their initiatives, it's understanding their lexicon and sort of mirroring that. That always has the greatest chance to drive two-way engagement, and we will coach you along to make sure that what our insights are understood. Then build trust and thought leadership. So understand leading physician or patient advocates, what their current initiatives are, what their interests are, and you can apply that to all areas and just display an understanding of these with their key figures of the ecosystem and the community, and you start building that relationship in an informed way. And then just finally, optimize your marketing plan. So we can execute this, especially in a multi-market where we're pulling together the through lines for each different region and subset and saying, okay, this is uniform throughout. So if you just want one unified marketing plan, you do that. Or you could do it in an extremely targeted way at a country by country and segment by segment basis, right? So to either extreme, whatever your budget allows, this should give you the information to do that. Okay. I'm sorry that I went over, but we'll turn it over to Andrea for Q&A.
Thanks, Ben. So one of the questions that we have received is, how long does an engagement typically last? And I think it's, correct me if I'm wrong, Ben, but I think around 8 to 12 weeks with an interim reporting as needed. And there is another question, which is, will we have the opportunity to engage with those doing the analysis during the project? Yes, we always provide interim touch points, feedback sessions, and full strategy meetings with the broader team as part of the overall engagement.
Yeah, and so just to build on that, I mean, you saw how deep or how high level we can go. We don't want to go too far down a rabbit hole. So if we do engage and we end up working together in the future, you may hear from me a bit at first, just to make sure that we're aligned on what the initiatives are. And these can change at any time, but we certainly don't want to be we're trying to keep these under 200 slides with only what's important to you at any given time so that they're utilized correctly.
Perfect. Thanks, Ben. I think then we close for today. Thank you very much for your interest and participation. We wish you all a good reminder of the day. Thank you and goodbye.
Yeah, thank you so much. Take care.
Bye.